Hello, friends. This is Jamie Vaughn, your host. I just wanted to come on here ahead of the next episode with a little disclaimer. This was my first interview that I had done for this podcast, and I've learned a lot since the beginning. One thing I've learned is to turn off the notifications for your text messages, either on your phone or on your Mac computer when you are recording. So, with that, this particular episode, I did not do that. And you might hear some dings here and there throughout the episode. I don't think it will impede too much, but I just wanted to give you the heads up that I know it's there and I wanted to let you know that it was there and I'm working on it. I know you're an understanding audience and I just appreciate your listening. So, with that, welcome to this episode of Test Those Breasts. Today, my guest is Cari Herington. Cari is the executive director for the Nevada Cancer Coalition. She has the honor of working with an amazing and talented statewide team to engage diverse partners from both public and private healthcare to corporate stakeholders to collaborate on reducing the burden of cancer. Some of Cari's most favorite pieces of her job include building unique programs to address cancer and drafting and working on policies to increase access to care in Nevada. Having lost her father to metastatic melanoma and other dear family and friends to cancer, she is extremely grateful every day to have this opportunity to make a difference. She is a proud mom of 20-year-old twin daughters, both in college, and an avid runner. Her golden retriever, Lucy, as her daughters say, is Cari's favorite child. Lucy is a trained therapy dog and also Cari's beloved running buddy. Well, welcome, Cari. Thank you so much for being here. I just really appreciate your taking the time to be with us today and just sharing your knowledge of how you help cancer patients. There's so much information out there, it gets very overwhelming. I am a breast cancer survivor, and I just remember all the overwhelming things I had to weed through and figure out and advocate for myself. Can you share what Nevada Cancer Coalition is and how they support Nevadans?
Absolutely. And thanks for having me, Jamie. This is a great opportunity to share a little bit about what we do and hopefully spread the word on touching those breasts, breast cancer prevention, early detection. Yeah, absolutely. Nevada Cancer Coalition is a unique nonprofit. We are a statewide entity in Nevada, and we bring together the state of Nevada, your private healthcare providers, your physicians, public health as well, anyone who's interested in working on reducing the burden of cancer in our state. So it's really cool. We basically bring together renowned St. Mary's hospitals, oncologists to work together in various ways. For example, we know breast cancer screening, Nevada does not have the highest rates for that. And so, how do we work together to increase that, to get more people screened for breast cancer? Anything from building specific programs, we might do some outreach. Perhaps you've seen our billboard with poop on it promoting colorectal cancer screening.
Wow.
Yes, I know all the fun things. We actually have an inflatable colon. So we do a lot of outreach in the community to share information and inform people, get to know your body, know what screening tests you should be doing and when you should be doing those. The other really fun piece that I'm so proud about is our Thrive Nevada program. And really, that's for anyone looking for where to get screened or cancer resources. If you've been diagnosed with cancer, or perhaps you're a caregiver of someone diagnosed with cancer and you just don't know where to go, you can call us and we can help navigate you through the system. We can connect you with resources, be it financial, transportation to appointments, or just help you decipher that information. As you mentioned, there's so much out there. It's very confusing. It's a lot to take in, and it's hard to know where to start. And so we have some amazing folks that can help you do that. And it's all free of charge.
I'm looking at the website right now and I know a lot about some things and I've never even heard of the coalition. And it sounds like you have so many fun and I shouldn't say fun, I mean, try to make it fun, but so many things out there that try to bring awareness to people. Do you have any statistics about how much that helps our community? Do you have surveys?
Yeah, so there's a couple ways. Again, because of our work, it's really the partners. So it's a Renown or a St. Mary's that, or someone doing a screening, such as Reno Diagnostic Centers. So really, when we're successful, it's because more people are going to see their doctor. And so they know when to get screened, or they found something, or they have questions about cancer, right? Really, our job is to bring together those partners to connect and work together, work on behalf of our community members. So we know we're doing great things when we see Nevada's screening rates for breast cancer increase, or we're hearing our partners say, gosh, we're not seeing as many people with late stage disease. So, in other words, people are getting screened, people are finding their cancers earlier when it's easier to treat. So that's how we can measure what we're successful at as a coalition.
Okay.
On the Thrive side, where we are working directly with patients and caregivers and those in the community seeking information, we can take a look and go, okay, we have helped so many people this month. We've connected them to this many resources. And we're also able to measure what barriers are out there. So we know that the majority of people calling us don't even know where to get screened for colorectal cancer or where to get a mammogram, for example. So then we know, all right, team, we need to get together and do a better job at sharing that information out to the community. So it's a nice little litmus test on our end. And then again, a lot of the ways that we measure the work of the coalition or just the work we're doing in Nevada cancer wise by those screening rates that we can measure nationally, of course, and then late stage disease and survival rates, frankly. So we know we're doing a better job in Nevada if we are seeing people survive longer after a cancer case, for example.
Interesting. Thank you for doing that. Know that your father passed away, and I assume that's one of the reasons you got into working with cancer patients and being an advocate and bringing that information. Is there any other reason that? How did you actually get involved with this coalition?
Great question. And coalitions are very different beasts. So I get asked that a lot. I actually found that I enjoy bringing people and organizations together to work towards common goals for the betterment of our community, from senior care to immunization coalitions to anything like that. So I love, again, bringing people together to partner on making the world a better place, essentially, which sounds a little altruistic, but that's really the best way to accomplish our goals is if we're all working together,
Yes.
pooling our resources and just understanding what the needs are in our communities in Nevada and working together to address those. So I found a love for building and sustaining organizations that do that, and I had worked on the immunization coalitions in Nevada. And then that's how I found out about the state coalition on cancer. And they had, let's see, the coalition probably started in the early 90s, which they did across the nation and other states as well. And our coalition was fantastic. A lot of the partners I mentioned earlier working together, they were all volunteers, volunteering their time to make this happen. So I was able to join as an actual paid staff person to give our work a little more legs, if you will. And that's how I got into it. But that's one of my greatest joys is being able to bring together people, be it competitors, to work towards a common goal and better our community.
I feel like you and I have very similar personalities. I've always been that way. And obviously, I started this podcast because of my own breast cancer journey and finding out all the things I never knew just because I
Yeah.
didn't have to. I've had friends who've had cancer, but there's so much more to know. And sometimes when you actually are struck with a disease like that, you are forced to get out there and look and find out things and advocate for yourself. So, again, that's one of the reasons I started this podcast in the first place, is because I feel like it's a good platform to interview people like you and just try to bring awareness as much as possible of where people
Absolutely.
get mammograms or tested for getting a colonoscopy or whatever. And yeah, I'm blown away that I'm just finding out about you. I actually saw you for the first time. A friend of mine sent me a link, the SB 330 that you just testified at recently. Can you share a little bit about that and what the effects are of that bill?
Absolutely. We at the coalition, one of the other exciting things I get to do is work on policy to increase access to care, essentially. Breast cancer and breast cancer screenings changed a lot in the last number of years. We had so many increases in research and technology, and we're able to find cancers easier and quicker than we were before. So a lot of things have changed, and unfortunately, our laws haven't kept up with those. In breast cancer, thanks to the ACA, we know that anyone can get a mammogram, and your mammograms are covered. So your baseline mammogram, you are able to get those free of charge. However, for those of us that have risk factors or dense breast tissue, that's been a big thing in the last number of years. I get my mammogram and I always get that letter in the mail that says, you have very dense breasts. You need to talk to your provider potentially about having supplemental screening, other screening tests. For instance, an MRI or an ultrasound. Because of my breast tissue, it's hard to see any abnormalities that on a mammogram, frankly. So there are other tests that I need. Also, given my family history, losing my father to melanoma, an aunt to breast cancer, those are risk factors. Other risk factors, if you are predisposed to or have found that you have a BRCA1 or BRCA2 gene mutation. There are other gene mutations that are also related to breast cancer. You are at higher risk. So you might need different testing options. Kind of the big message here is we are all individuals. We're all very different. Talk to your physician about what's right for you. Yes, this recommendation might say, oh, you should start screening at this age and mammogram, but you might need something different. You might need to start screening at a younger age. Or again, if you have these risk factors, you might need something more than a mammogram. We started working on this bill, and a number of other states have done the same. In fact, 12 other states have passed similar legislation that not only ensures your mammograms are covered, but that supplemental screening is covered as well without any out of pocket costs. So, yay, I can have my mammogram. And then if I get that letter that says you're at high risk, you should talk to your doctor. And my doctor says, Carrie, you should be getting an MRI every year in addition. So now I can get that MRI and it will not cost me out of pocket to do so
So no
because it's still
deductible cost.
screening.
Yeah. Yeah.
It's still
Because
a
a lot
screen
of people
match.
have like $1,000 deductible that they have to reach,
Yes,
and it becomes this, okay, I need to put food on the table for my kids right here. And let's face it, there are people who literally cannot afford that. And that leaves all of them out. And so it's when put food on the table for my kid, or do I get a mammogram? You know,
absolutely. And Jamie, we've gotten many of those calls over the years, and it's heartbreaking. And then what happens is for those of us that might have gotten a mammogram that says you need these additional tests, and we put them off because we can't afford them. And then unfortunately, if we are now diagnosed with breast cancer, we've now found a lump that, oh gosh, it's very large. We weren't able to get those tests because we couldn't afford them. Now, unfortunately, our breast cancer might be a later stage, which is a challenge. And now our options are lesser. Treating it will cost us more. It's just a never ending cycle. And breast cancer it's the most expensive cancer, honestly, to treat, the most expensive cancer to our country. It's the most expensive out of pocket costs for treatment to patients is breast cancer, unfortunately. So to have to pay all these costs just to be screened for and perhaps diagnosed, so you're already paying all this money before you're even diagnosed with cancer is not okay, ultimately. It's just not. So we need to provide everyone with the same screening opportunities across the board.
And 1 in 8 women, we know, right? And is that still the statistic? 1 in 8 women get breast cancer. So we know it is a need. And I liked the justification about the insurance companies is like if we can detect breast cancer at an early stage, it's going to be less money for the insurance companies. And
Back.
if it's a later stage, it's going to be way more. So I feel like it's such a logical wrap your mind around thing that you would think they would be like, yeah, let's do this because it's going to cost us less. Yeah. Do we know when we will find out when that's going to hopefully pass?
It did pass out of an assembly committee yesterday. So we do have a few more steps. I know we're so excited. We're
That's awesome.
feeling very positive about it. So if and when, I should say, when this bill passes, it will go into effect January 1. Now, Medicaid already covers all these tests for anyone needing them. Medicare also covers these tests. And so if this bill goes through, it will apply to your mainstream private insurance companies that will cover these tests as
Okay.
well. So we're just trying to reduce those barriers and make these things available to everyone. And
That is
men as well. Men get breast cancer too.
They do. I have a
Yeah.
friend whose husband had breast cancer, and I never even knew that. Who knew? I mean, they have breasts, right? So why not?
Yeah.
We're made up differently, but I found that very fascinating. So I try to make sure people also know that. So it's not just about women. I get a mammogram every single year, and I've always been very good at it. I've known for quite some time that I have dense breast tissue. And so I was just very vigilant, and I've had 2 lumpectomies in the last 8 years, and they were both benigns, but I get this little ping on my phone saying, "Hey, it's time for your mammogram." Mine, I got one last year, last June, or 2 years ago, June, and when I was diagnosed last June, my lump was like 5 centimeters. It was aggressive, and so it grew that fast. So some people need to get mammograms maybe even more often, I guess. I have reconstructed breasts now. So I guess I don't have to get mammograms anymore, but I have to get scans and things like that. Yeah, I was stage 2, which was far enough for me. It was scary enough and far enough. And I had to go through the whole
Okay.
rigmarole, the whole chemo. And I ended up getting a double mastectomy because both breasts were dense, and I just didn't wanna go through that again. I'm really thrilled that that's starting to inch forward, and I'm very hopeful. How can people get help through the Coalition for Caregivers? That's a big topic, and I have friends right now who have caregivers who are just overwhelmed, and because the caregivers are so incredibly important, and it really plays a number on their psyche as well. And so how can they get support through the coalition?
Really good question. And you're exactly right, Jamie. Cancer affects an entire family, family, friends. It affects everyone. And if you're a caregiver, it's a lot. And it can be devastating on your health as well as a caregiver. So, our Thrive and Be program that I mentioned will navigate people to screening or patients to resources. We're there for caregivers as well. So you can find it. You can apply online. There's a little form you can fill out, or you just call. So there are things out there for caregivers. There are groups for caregivers. A lot of times caregivers will call us kind of doing that footwork for their family member or friend with cancer. Where do we go next? What do we do? How do we afford this? So oftentimes it's the caregivers reaching out anyways, not necessarily the person with cancer. So we can, again, connect that caregiver on behalf of the person with cancer to resources needed, to perhaps the navigator at a cancer facility. This is one of the other pieces we had heard a lot of is people wanting to connect with other people in the same boat, right? So I have colorectal cancer and I'd like to connect with someone that has my same cancer so I can ask them questions, see how it went for them, or a caregiver might want to connect with someone else with a similar cancer or another caregiver. So we're working with a great organization called Immerman Angels. And again, there's no cost for any of this. And you, as a caregiver or someone with cancer, can ask for a peer mentor, someone to connect with, or you can become a peer mentor. So you can be that angel for someone else. A lot of times, people going through it or who have gone through cancer, they're like, I want to share my story, or I want to help someone else, or I want to share what happened to my family member that I unfortunately lost to cancer. And so Immerman Angels offers that opportunity so you can be a mentor or a mentee. So it's a nice opportunity in both aspects and a great way for caregivers to connect with others going through something similar.
That's such a great service. And I just know that some of the husbands that I've met are some of those people who are like, oh yeah, yeah, I got this. I got this. We got this. We're going to get this. I got this. And they don't reach out for any kind of
Yeah.
help. My husband was actually one of them. And so I was the one who was always sending him things just because I like to take control like that. But I so wanted him to reach out and get more support. We're okay. We made it through, tumbling through. But sometimes men who, and maybe women too, but I've just seen the men who are, yeah, I got this, honey. We're going to get through this and
Absolutely.
we're going to, right. They just don't know how impactful the diagnosis is and the journey they're about to embark on. And it's a lot more than people think. So I like the idea of the peer mentor. I would love to be part of that because right now I just talk to friends. I have a private Facebook group quite a few people are on that have followed my journey, and I'm very open. I talk about the good, the bad, the ugly, and I put out there what I've learned. And people have reached out to me and said, hey, thank you so much for putting that on there because I had no idea. And so I feel like the more people we can get like me and a few others I know out there telling people about these resources out there and that it would benefit them greatly, the better, right? So I just, yeah, I'm so
Yeah.
excited that you guys have that.
Well, and thank you for doing that and sharing your journey with others because it is absolutely so helpful. I've
Yeah,
not been through it. I can share resources, but it's not the same as having that peer.
right. But Carrie, I feel like if you ever do have something that happens, you know where those resources are. You've heard stories. You are empathetic. You understand a lot more than a lot of other people do. I know that some women who get breast cancer just are not as open as others. I just found it very therapeutic for me. It was very healing for me. And I think it provided really good information to other people. And I know that they just appreciated that. I really appreciate your being here. This has been educational. And I just want people to reach out to the coalition. Are there other coalitions in other states? Because people from other states will be listening to this. So I would encourage people to reach out to their own community to see what kind of cancer support there is out there. I just thought it was at Renown. So, like, I had a nurse navigator, and if I had any questions, I would ask them, but to know that there are other support out there as well.
Jamie, you're exactly right. The navigation model is really the key. We started that here in Nevada a telenavigation component, essentially, more or less because of our rural locations. Folks with cancer in the rural locations don't typically have access to a navigator. They do have navigators at Renown and St. Mary's, but oftentimes they haven't always been able to reach all of the patients coming out of their facilities. So navigation's truly the key. And we're helping in that realm, if that makes sense. So other coalitions across the United States probably don't have a some of them do, but most of them don't have the navigation component. But if you are in another state, that is key. If you ask for a navigator, wherever you're getting treated, ask for a navigator. And they really are doing just that, connecting you with resources, helping you walk through your journey, understand the medical components and your options. That's exactly it right there.
That's how
So,
I thought I could get a wig.
yeah.
I didn't know where to get a wig. I love the Moms on the Run through Pinocchio's.
Yes. They're
I
fans.
I knew that they were a resource, but I did not know how much of a resource they were. And I'm just so grateful that there are people in our community that take such pride in helping people. Carrie, I'm just again very thrilled that you agreed to interview on my podcast. I just feel like this platform is so essential and lots of people are listening to podcasts. So
I
I
know.
was looking around. It's like I was looking around for podcasts on breast cancer, and there are some. I just wanted to be one of those people because the more we have, the more avenues of getting that information out there, the better. In the show notes, I have your phone number and your email address. If one wants to reach out to you. And I also have the website for the Nevada Cancer Coalition in the notes as well. Is there anything else you would like to add?
No, yeah, I think we've had all the great points. The key is to know your own body, know your breasts, and know what the right screening test is for you. And that's really the key. And then again, if you do end up with a case of cancer, there's so many advances in today's world. So again, connect with the navigator and they can help you walk through your journey. And just, we're thinking about all of you out there, and screening is the key. So keep
Yep.
on screening.
Yes. And that's why I named it Test Those Breasts, because when it all comes down to it, that's the key is early detection. Thank you for that
Absolutely.
bit of information. All right, Carrie. Well, thank you
Well,
very much.
thanks for doing this, Jamie.
Yes.
We appreciate it.
And to my audience, thank you for listening to Test Those Breasts, and we will see you on the next episode.